Hi everybody. Today we are talking about identifying the complications of elder care. Caregivers are asking how to manage all these complicated health issues when elderly parents have one condition on top of another on top of another. Now, studies confirm that about 50% of people over age 55 have 4 or 5 health conditions. So, if you, your elderly parents, or somebody you know are in this 50%, stay with me because I'm going to share tips to help you advocate for yourself or a loved one. Because when health conditions stack up, it's really up to you to connect the dots to make sure that you get the care that you want. I'm going to share the risks that exist working with healthcare systems when people have multiple conditions that caregivers and patients must be aware of so that you can get the care that you want and avoid issues that can be prevented. I'm Pamela D. Wilson. I am a caregiving expert, advocate, and speaker with almost 25 years of experience. I respond to caregiver and patient and aging adult questions by creating these videos here on my YouTube channel. So please click below, like this video, follow my channel, comment, even if all you do is say, hey, thanks for the video, so that other people can find their way here. My website, PamelaDWilson.com, also has plenty of free resources, online programs, classes, my podcast, articles, so much more information. And if you want to speak with me directly, you can visit my website, PamelaDWilson.com, look for the Contact Me button on the upper right, complete the form, and you can have a one-on-one consultation with me. On the other hand, if you are with a corporation or group and you're looking for a speaker, you can also complete that same form and let me know how and where I can speak to your group. So before I get into the tips, I want to share a great source of research for you if you are a person who likes to get into the nitty-gritty of the details and look at research like I do, right? There is a study called the Health and Retirement Study that has created a lot of research, a lot of articles have come out of this study from researchers all over the world who take the data and do their own research and publish studies. So this health and retirement study, it surveys people in the United States and it's managed by the University of Michigan. It's funded by the National Institute on Aging and the Social Security Information. So if you're interested in finding it, just Google Health and Retirement Study, University of Michigan, and you will get to that page. So when we talk about how to manage multiple health conditions, if you are a caregiver for a loved one, or if you are actually the person with the conditions, it's a very deep and complicated topic. So for the purposes of this video, I'm going to narrow this a little bit and talk about the top medical conditions that people over 55 experience and how these result in situations that you will want to navigate through with your doctor and with specialists and with the healthcare system. So you may be familiar with some of these because you may be diagnosed with them. Heart disease, congestive heart failure, diabetes, arthritis, COPD, breathing issues, asthma. Maybe you've been diagnosed with cancer. And then the icing on the cake for all of these is many people who have 4 or 5 of these conditions also have dementia or Alzheimer's disease, which just complicates everything so much. So dementia is a term for general memory loss that can be related to any one of these health conditions. And many times it actually results from the conditions that I mentioned, especially circulatory disorders, which include heart disease because your heart pumps, right, and it sends blood all the way throughout your body. Diabetes can result in circulatory issues, and heart disease and diabetes and other conditions can result in a stroke. So dementia has also been associated with neurological diseases. So people who have Parkinson's, Huntington's disease, multiple sclerosis, or ALS, which is called Lou Gehrig's disease, can also eventually experience memory loss and dementia. So there are 2 other conditions that came out of this health and retirement study, and they're the healthcare system likes to call them syndromes, so geriatric syndromes. So if you have, heart disease and arthritis and diabetes, you are more likely to fall and you're more likely to have incontinence. Okay, and those are subjects that I'm going to share in a separate video that will be coming up very soon. So if you or an aging parent have any of these conditions, I hope that you have a primary care physician that you see and trust. Then I recommend seeing specialists to help you manage the conditions. Because the risk here is that a primary care physician is skilled in general care. And if you have a heart condition and you are different from other people, and maybe it reacts this way, or maybe it causes these complications, right? Seeing a specialist can help you manage through those changes better. They can also prescribe medications for you to help manage the disease, make recommendations about things that you should do, like exercise and eating better and giving up junk food, all the things that we know that we should do, but that are very hard to change long-standing habits. So, examples of specialists. A cardiologist manages heart disease, an endocrinologist manages diabetes, a rheumatologist manages arthritis, a pulmonologist manages breathing issues like COPD and asthma and bronchitis, an oncologist manages cancer. So how do you get to see some of these specialists? Well, if you have Original Medicare, which is that red, white, and blue card, you can just call and make an appointment. However, if you have a Medicare Advantage plan, which means you gave up the red, white, and blue card for a plan like Kaiser or United Healthcare or AARP or Humana or Cigna or another health insurance company name, you may have to get a referral, which can take a little longer. And sometimes doctors don't want to do that because it affects the costs and the profits of the insurance company. Where Medicare Primary is run by the government really doesn't care about, I don't want to say doesn't care about, but they're not profit motivated. They're not shareholder motivated. They're not looking to make all this excess money off of patients so that they can give it to somebody, right? Where private health insurance companies, that's how they survive. That's how they make money. So when you look at all these conditions, question you might be wondering is, well, whose responsibility is it to manage these? Why can't my doctor take care of that? Well, in a perfect world, that would be a great solution. But unfortunately, at the present time, and I will explain why, don't go away, the responsibility to manage multiple conditions falls on patients and their caregivers. Because healthcare is disease specific, right? It looks at this disease separately from this one. And there's a lot of gaps in technology that I will explain, and policies for how doctors treat patients and how they get paid. So I want you to be aware, if you're a caregiver, a patient, loved one with any of these conditions, it's important that you know what you're dealing with. So I'm going to share some statistics, and this is from the Agency for Healthcare Research and Quality. And it's available on the internet. You can find it yourself. But people who have 3, 4, 5 health conditions, in addition to dementia and Alzheimer's and the syndromes of incontinence and falling, result in 64% of all doctor visits. People with multiple conditions represent 70% of all hospitalizations and 83% of all prescription drug costs. People with more than 3 or 4 or 5 chronic conditions raise healthcare spending. They represent 71% of all dollars spent on healthcare. And when we limit that to Medicare, so people over age 65, 93% of all Medicare costs are people who have multiple health conditions. So obviously the best way to keep your costs low and live the retirement of your dreams is to be healthy. But if you're already in this situation, you can't turn the clock back. You can't say, oh, I have these 5 conditions and tomorrow they're just going to go away, because it's likely that they have progressed. The statistics also show that women are more likely than men to have multiple co-occurring conditions. You might wonder why that is. Women are caregivers more than men. Not that men are not caregivers, because I get a lot of people commenting and saying, well, I'm a male and I'm a caregiver. I understand that, but the statistics are 60% women, 40% men. Women raise children. They raise grandchildren sometimes. They care for aging parents. They care for spouses. They care for grandparents. They care for themselves. People who are caregivers can get sicker than the people that they care for. So, bottom line is the result for caregivers and patients who have multiple health conditions is that you go to the doctor more, you take more prescriptions, you may be in and out of the hospital more, and that can place you at risk for being eventually in a nursing home, which is not a place any of us want to be. So, all of these conditions that occur at the same time that are different result in this definition of what's called fragmented care. So it means that because you see multiple doctors, you can have medications that interact negatively with each other that actually make you sick instead of feeling better. You can receive a recommendation from this physician over here that disagrees with this physician over here. And it's your job to bring the two together to figure out, should I do this or should I not do this, right? There's a possibility that this physician is going to order the same test that that physician does. This is why you as the patient or the caregiver have to keep track of this so that you're not being billed for the same thing over and over and over again, or you're running to this lab and that lab and you're spending all this time on when you could just do this once. Okay? Now I want to share one habit that people have that increases the risk of developing multiple conditions. And I know some people are not going to like this, but it's smoking. Smoking can increase the likelihood that you are going to have heart disease, diabetes, dementia, and depression. And let me use my own life situation to share about this. If I've never talked to you about my mother before, if you've never seen a video talking about my mother, Rose, God bless her, she was a pack-a-day smoker for a lot of years. And the result was early in her life, so I'm talking early 40s, 50s, even before she got to her 60s, severe heart disease, indigestion, stomach problems related to smoking. She had mini strokes. She ended up having to have quadruple bypass surgery because the arteries in her heart were so clogged from smoking and from a not so good diet. The consequence was, after all these health conditions, after many years of being sick, because honestly I remember her being sick most of her life, she ended up with bladder cancer from smoking. And her liver was compromised because of surgery, and she got hepatitis. So, my mom, God bless her, love her, best mom in the world, but her health was just a freaking train wreck. I would like to help you avoid that by sharing the information that I share in all these videos. So as a caregiver, as the person who needs care, and as a healthy person today who may eventually interact with the healthcare system, be healthy, do whatever you can to change your health, to improve your health. But it's also important to know what doctors and the healthcare system can do and can't do, because honestly, they are not at a point where managing multiple conditions happens, because they're not paid to support cross-physician care. To get paid, physicians have to bill for a diagnosis code. They have to bill for a procedure. And who creates all these codes? The government. The government has not yet figured out a way to implement what they call whole person care. You may start hearing this term because it's becoming more and more talked about because of that number that I explained a few minutes ago about the costs to the Medicare system of sick people. It's a great idea. There's just no practical way to put this into practice yet. So let me share a story of what I'm describing so that you can see how this might affect you or a loved one. Now, this was a client that I had when I managed care. I was her guardian. And the care was between her primary care physician, an orthopedic doctor, and an orthopedic surgeon because she had a fall. Now, she had high blood pressure, she had high cholesterol, she had thyroid concerns, she was a little overweight, and she had dementia. So, the complicating factor here was having dementia and not having an orthopedic doctor and an orthopedic surgeon who understood dementia and the effects of dementia and how dementia complicates care for people who have other health conditions. So what happened was my client broke a hip. When you break a hip, 3 options: full hip replacement, partial hip replacement, nothing, okay? The orthopedic surgeon, not knowing anything about dementia, picked the middle option. So with a full hip replacement, you go to the hospital, you have surgery, you're up walking because they want you to be walking. With the partial hip replacement, they have you become non-weight bearing for 6 or 8 weeks to give your hip time to heal. Now, if you have dementia and you have memory loss, what do you think happens when you don't walk for 6 or 8 weeks? You forget how to walk. So my client, who was walking before, mobile, getting around, doing everything till she fell, right, was stuck in a wheelchair and in a nursing home bed for 6 to 8 weeks. After that, she couldn't stand. She couldn't remember how to put one foot in front of another, no matter how hard we tried. We had her in a nursing home walking with her hands on parallel bars, and she couldn't initiate. The brain up here couldn't say, I need to put this foot in front of this foot, in front of this foot. So she ended up wheelchair bound. And because she sat so much and was in a care community and the care staff didn't check, she got wounds on her bottom, which turned into serious wounds, which is what she actually died from. So unknowingly, this orthopedic doctor and this orthopedic surgeon, by their choice not to do a full hip replacement, basically checked her life off the page. She died. This happens more than you might imagine. So, how do we get all this stuff going? Why isn't it working? It's not working because federal and state governments and healthcare systems are not there. So it really could be a long time before we get to a point where, an orthopedic doctor and a cancer doctor and a cardiologist and an endocrinologist are all working together, looking at you as a whole person, looking at me as a whole person, and coordinating our care. So in the meantime, it's up to us to do this because who cares about us? We care about us. Who cares about our loved ones? We care about our loved ones. If we want better care, we have to find a way to get it. Now, there's 2 other conditions. Mental health, right? So depression, bipolar disorders, things like that. And then substance abuse, right? So these are 2 other conditions that a lot of people experience, but they're outside of this healthcare bubble, right? So normal doctors don't deal with mental health, and normal doctors don't deal with substance abuse. So what happens is when people have all these needs and there's no single plan of care, patients fall between the cracks. Now, as I talked before, there's a gap in electronic health systems. If you're a caregiver or a patient, you might have found this. You go to one doctor and that doctor doesn't have records from doctor number 2 or doctor number 3. So you're having to collect all these records, download them off portals, and take them physically and say, here are the records, put them in your medical system. So not having these record systems connected, right, makes it impossible for any single doctor to see the whole picture of your health or your parents' health. And if you live in one state and you move to another, your records may or may not follow you. So again, it's up to you to make that happen. It means that this responsibility falls on patients and caregivers. If you don't do it, it's not going to happen, which means that you need to become a little more computer savvy if you're not, and access online healthcare records, online doctor portals, learn how to navigate through all these things so that you can download these records and keep them. Because sometimes after 7 years, poof, they disappear. So let me take these gaps to the next level of care, especially for older adults who are hospitalized, and then maybe you go to a nursing home for treatment, and then maybe you come home and home health comes in, right? So in addition to the gaps between your primary care doctor and all these specialty physicians and the hospital, there's this other gap called post-acute care. It's the care that you receive after going to the hospital. And then there's community care. So The medical records at your doctor's office and specialists and the hospital don't talk to the medical records in a nursing home and in an assisted living community and with home health that does physical therapy and occupational therapy and speech therapy, and sometimes with a hospice company and sometimes with a pharmacy. So no wonder this level of care for people with multiple conditions is so hard to coordinate. And honestly, it's just the tip of the iceberg related to federal and state health care, government policies, rules, and regulations, which is why, if you have the time, it really is beneficial to get involved at a local level and see which of your legislators are advocating for healthcare reform and what they're doing, because there's a lot of duplication of effort and it wastes a lot of money. So I know that for caregivers, for all of us, right, managing our daily life, our jobs, our families, caring for children, maybe going to school, it's a big challenge, right? And then we add on top of this being a caregiver, and then add on top of that 3, 4, 5, 6 medical conditions that are causing problems, and we don't know why they're interacting with each other. This puts a lot of burden on the caregiver. But really, the bottom line here is that if you don't become interested and involved and learn about these conditions and how to advocate and how to bring all of your doctors together, focusing on whole person care, you or your parent are not going to get the care that you receive. There could be errors in medical treatment. There could be treatments that you might be able to have that you don't even know about that could just change your life or change your parents' life and make it so much better. So the responsibility lies on you. Where do you find a lot of help for this? My website, PamelaDWilson.com, has a lot of free information. I have 3 online courses, one very specific to caring for aging parents. It is based off my lifetime, 25 years of experience. A lot of detail there. It's free. You can go and watch the webinars. Okay. Also, there's hundreds of videos here on my YouTube channel. If you have questions for future videos, again, please like this video, follow my channel, put the comment, put the question below. I will do a video on the question you are asking. So I thank you so much for being here, and I thank you so much for being interested in learning how to advocate for yourself and your loved ones, because it truly can make all the difference.